to invest in new long-term care beds. And the private sector have told them, in order for this to be profitable for us, you're going to have to double the fees on long-term care beds from $50 a day to $100 a day. Now, how many seniors can afford that kind of care? So I want to just talk about where this all came from, if I can, for a minute. Because, you know, it's interesting that poll after poll across Canada, and that includes Alberta, shows that a large majority of the public want to strengthen and keep the public healthcare system. And yet governments, not just this one, but other governments as well, keep making attempts to bring in more private healthcare delivery, to privatize our system. That doesn't make sense. You would think that a politician would look at the poll and say that 70% of the people want public health care, I'm for public health care. But that's not happening. The question is why? Well, in Alberta we spend about $11 billion a year on health care. Almost all of that money is in the public domain. You could multiply that by 10 and you probably get a good approximation of how much money is spent in Canada on healthcare. And you have dozens and dozens of healthcare corporations, insurance companies, drug companies, private healthcare delivery companies that look at that money and they just drool. They want that money to come to them before we get any healthcare services at all. They want it to pass through their books and so they can make a profit. And so they bring relentless pressure on governments right across Canada to bring in more private healthcare delivery. That's why we keep having to fight this battle over and over again. But you know what, my friends? We have stopped them before, and we sure as hell will stop them again. Now, I just want to talk a little bit about the specific situation we have in Alberta. People may know the name of Mazankowski. You know, it's more than a name on a heart hospital that has nobody in it. It also is a former deputy prime minister under the most corrupt government in modern Canadian history, the Mulroney government. And he was engaged by Ralph Klein to develop a report on the future of healthcare. And of course, he's on the board of directors, I think it's Great West Life Insurance Company as well. And he produced a report. And it had some good recommendations, some of the usual stuff, healthier lifestyles, all of that, prevention, some good things. But it had 3 core recommendations that we should remember, because it's the Mazankowski report that Mr. Lethbridge is following. And they are more private delivery, delisting of services, and more user fees. All of those recommendations. Now, Mr. Mazankowski is also the political mentor of one Ed Stelmach. They both come from the Vegreville area, both conservatives. And when Mr. Stelmach was elected premier, he called in Mr. Lethbridge, offered him the job of health minister, and says, here is the Mazankowski report, you implement it. And that, my friends, is what's happening. Now, I think that we can stop them. We certainly stopped the third way. I remember Iris Evans touring the province, talking to people and listening to people and getting an earful, because I followed her around. And we talked to people as well. And I know that the majority of Albertans, including a majority of Albertans who vote Conservative, do not want to see private healthcare. And they certainly don't want to see our healthcare system in the chaos that it currently is. So I think that we can stop them. What do we have to do about it? Well, I think we need to keep fighting. We need to keep having meetings like this. We need to have marches like you had recently. We need to have petitions. And we need to let our MLAs know that private healthcare and chaos in our healthcare system is unacceptable, and if they support it, they will be out at the next election. That's what we need to do. The progressive Conservatives cannot be trusted with our public healthcare system. They've proven it over and over again. And I just want to do a little commercial here for the NDP, since I'm the leader. And I want to tell you that we are the most reliable defenders of the public health care system. We invented it. We've got a big stake in it. We believe in it, and we'll continue to fight for it. And one of the ways that you can help to fight what the government is doing in public health care is get involved in different organizations. We would like you to look at us and take a look at the NDP and consider getting involved. Certainly you should be involved in Friends of Medicare. Certainly if you belong to a seniors group or some other organization, a healthcare union, then those organizations are also standing up and fighting for public health care. My friends, I want to leave you with a message of hope that while they keep trying to privatize our healthcare system, while they keep trying to mess it up, we know that the most effective way of delivering healthcare, the cheapest way of delivering healthcare, is our public healthcare system, publicly delivered healthcare system, publicly controlled. That's what we believe in. I think you believe in it too. Let's fight together because we can stop them. Thank you.